absolutely random. Only about 10% of cancers are really hereditary. My name is Dr. Ellie DelGiacco. I'm a medical oncologist, a hematologist as well. I'm a medical oncology, so that means I give infusions, I give medications to treat cancer. Virgin Islands, we have, in the grand scheme of things, the cancers that we have here are the same cancers that we would have anywhere in the States. So the most common ones are breast cancer, prostate cancer, and colon cancer. We also have a lot of like lymphatic cancers, like lymphoma, myeloma, that type of thing. But by and large, breast cancer and prostate cancer are the ones that we tend to see every single day. Most important thing to note is that cancer treatments are available here, number one. It doesn't have to be something where you avoid getting the mammogram or you avoid seeing your doctor. When there's an issue, see your doctor, get referred to a specialist who can deal with it. And then from there, we can always give you a great recommendation on if it's something that you need to leave for or not. But I see a lot of people delaying treatment because I'm waiting for a plane ticket for 3 months to get that, my thyroid checked out or whatever. And I think a lot of that can be done here more efficiently. There's different recommendations for different screenings. So I guess the earliest would be for cervical cancer, with pap smears. Starts in the teenage years. Then for women, the next thing would be for breast cancer. And we usually start at the age of 40 unless there's other significant, changes in their family history, or if they've had some abnormal, physical exam findings or something else. And the same goes for colonoscopies. Those start around 50, but with family history or other changes, that'll be at age 40 as well. So, we have to start thinking of certain cancers like very early in your teens and 20s. Cancer diagnoses are just completely random, and this is why we have screening for everybody. This is why everybody's recommended to get a mammogram. Everybody's recommended to get colonoscopies. Men should probably be screened for prostate cancer with PSAs. There's if you're a smoker and have a risk there, then there is some recommendations on when to get CT scans and things of your chest. But a lot of times it's just completely a random thing. 1 in 8 women will get breast cancer, and it's not in all of their families. Exactly. The whole point of doing cancer screenings is so that if you do find something abnormal, that it's found like before you became symptomatic or before it was a problem. Most early stage breast cancers, if found early on mammogram, can be removed and you're cured. Most colonoscopies are done and there's a polyp and it can be removed and that's it. If you leave it there for 10 years because you don't have a colonoscopy, then we're running into risks of it developing into a real cancer. I mean, when you first are told you have cancer, there's a lot to do. I always like when I'm having a consultation, the first one, like, okay, we have a lot of homework to do today. There's going to be, whatever it is, a CT scan, a referral to the surgeon, this, that. There's probably 10 different things that all need to happen pretty quickly. What my office does is what a lot of cancer centers would do in the States, where we basically have like a nurse navigator where that nurse is helping you, make all the appointments for you. Like, we're not going to just hand you a referral and, send you on your way. We try to make sure that appointment is actually made. We know when it's happening, and we follow up with you after it. In addition to that, we do have in our St. Thomas office, and she can do remote help to St. Croix, a clinical oncology social worker who specializes in exactly this type of stuff. If it's like a financial difficulty, if it's applying for grants, if it's applying for manufacturer assistance from the companies that might be supplying chemotherapy, if it's just talking with the patient for a half hour and talking with the family and having a family meeting, who's going to help drive the patient to appointments, or do we even need that? Who's going to help, pick up the kids from school, like whatever it is, that can be a conversation with our social worker. That can be a conversation with our nurses who really specialize in it and spend a lot of time doing that. Again, a lot of people ask about diet. We have a dietitian. on our staff who can kind of like guide patients in what's a good like diet to change to if you need to at all. People are always asking about supplements and different things, so that is all tied into maybe not the first visit, but throughout the cancer treatment plan. We have physical therapists that specialize in lymphedema therapy that comes into play with a lot of breast cancer patients and others as well. Yeah, so cancer support VI we use, I would say, on a daily basis for all sorts of different things, all sorts of gaps in coverage for actual treatments themselves, for co-pays, for travel, for whatever else it is. There's always something that could fall through the cracks. So we find ourselves, thinking of grants for patients when there's a huge copay for a medication, or they have to travel emergently up to the States to have a surgery or radiation or whatever. Some people have used it literally for childcare while they're sitting here getting chemotherapy. Some people are using it for the bus every day. Whatever it is, the grants are going to a good use. Just this week, we're using a grant to help pay for chemotherapy for a breast cancer patient that she would not have otherwise been able to afford at all. So it's really, in a lot of ways, life-saving. I have a practice both on St. Croix and on St. Thomas, where we primarily are giving chemotherapy, immune therapy, hormone therapy, different pills, like whatever type of treatment that you may need for cancer. We're usually able to provide it. We take, all sorts of insurance. We take people without insurance at all. There's a lot of different like manufacturer assistance programs and things that we can use to get cancer treatments, even if you don't have insurance. But we're generally able to do all sorts of treatments. What we don't have is radiation. That's what we used to have in St. Thomas, and they're working at rebuilding that hopefully in the next year or two. Have an office on St. Croix and on St. Thomas, stxcancerspecialist.com. And you can refer a patient on the website, or you can request an appointment on the website. That website goes right to my email, and I screen all of those immediately. 772-1551 or 776-1551.